TransMed7 is a medical device company. The trans is transformational, the med is medicine, and 7 is all 7 continents because we want to be a global company. We at TransMed7 are composed of a very experienced group of clinicians and scientists. We're passionate and compassionate about the care of patients. So we went into this, I believe, for the right reason. We wanted to create biopsy devices that meet the needs of patients. Patients don't want to undergo a biopsy. Just the fact that they may have a diagnosis of malignancy is scary. Undergoing a procedure can potentially be painful, it's unknown, so you don't know what to expect. Our goal was to be able to create devices that were easy to use for the clinicians. That makes the procedure simpler, decrease the time involved, increase the accuracy and quality of the specimens that were obtained. So if a patient ends up having less time involved in the procedure, smaller needles that can decrease the pain, and ease of performance by the clinician, that can decrease much of the frustration and anxiety of the patient. I've been in medicine for over 30 years, and while I've seen substantial progress in medicine, I've not seen the kind of advancements, especially in biopsies, that I would hope. I'm a cancer survivor, and so I know what it means to undergo biopsies, and it's an anxiety-provoking and potentially painful procedure. We have the opportunity at TransMed7 to develop devices that can decrease the pain, decrease the time involved, and therefore decrease the anxiety of those biopsies, while at the same time providing biopsies that are high quality and reliable. Forever, we've been doing a biopsy with what's called a side-cutting type device, and there's a host of limitations to that device that are well known to clinicians. But until now, there's really not been an alternative. When you do a side-cutting type of a biopsy, you're limited by the size of the trough. In other words, the length of the trough is the limit of the length of the biopsy. Moreover, there's an area in front of the trough that we call dead space that really is of no value. And in that area, there's a sharp needle that can cause damage by going beyond the area of the biopsy, as well as damaging normal structures, such as vessels. The biopsies at TransMed7 are truly transformational. TransMed7 has developed a forward coring device that obviates many of the problems with the side-cutting devices. Specifically, we end up having the ability to decrease the size of the needles, which can decrease discomfort and also allow access to areas of the body that we weren't able to access before. The benefit of not having to replace the needle in a biopsy is many. Those include the fact that you don't have to take time removing the needle and then replacing the needle under image guidance. It's very frustrating for a clinician and for a patient to have a needle advanced, be looking at some type of an image such as an ultrasound, be satisfied with your first pass, then have to take that out and do it all over again. With a single insertion, multiple sample device, we simply have to bring the needle to the lesion one time, and then we can slightly adjust the direction of our forward coring biopsy without having to remove it. So time is one of the factors. The accuracy of being able to only have to come in one time. Potential for infection. Every time you remove the needle and re-advance the needle, you're coming through that tissue pathway, so that has an infectious increase. And just the simplicity of being able to connect and collect all of the specimens in one chamber at one time, as opposed to having to take the needle out, put it in a specimen, reinsert, put it in a specimen, etc.
I was impressed with the ease of use, with how easy it was to set things up, how easy it was to target with it, how easy it was to take multiple cores of tissue in a very short period of time, and how we could actually examine those tissues for quality and could see that we were getting good quality tissue samples.
At TransMed7 we have a variety of different devices, but we've started our focus in the Speedbird family of devices. And the Speedbird family is intended primarily for breast biopsy utilizing ultrasound. But related to that is the Concord devices. Concord is utilized similar to the Speedbird device, but intended for stereotactic biopsy of the breast. The combination of the two really addresses the needs of breast biopsy in all the circumstances that we encounter today.
This could impact patients and their doctors in ways that go beyond just diagnosis. We have the ability to get more tissue so that we can do genetic testing on the tumor samples and then that can guide therapy. The future is genomics, being able to test tumors for the genetic mutations that cause these tumors to grow. If we can do that and get those tissues easily and accurately, we can test the tumors, find more effective treatments for the patient.
While we're starting our focus with Speedbird and Concord, and primarily for breast biopsy, that because of the truly transformational nature of the working element, the primary element within our devices, the applications are broad, and they go well beyond breast. Certainly with Speedbird, there's a potential for biopsy in areas such as the liver and the prostate. The devices can be utilized on a flexible catheter for endoscopic applications. We recognize that because of the scalability, the ability to be able to take the needle down to a much smaller size, and the flexible catheter, that we have future applications for vascular interventions. Therefore, I think the summary is that it's a very exciting time to be a part of TransMed7, and the opportunity to make a difference in patients' lives is significant. At TransMed7, we think big by creating small.